Is it dandruff or is it psoriasis? If you've got flakes in your scalp, there's a good chance you have asked yourself this question at some point in time, probably why you clicked into this video. Good news, I'm going to give you some practical pointers on how to tell the difference between scalp psoriasis versus dandruff. What exactly is psoriasis? Psoriasis is an immune-mediated chronic disorder that creates inflammation throughout the body, not just in the skin, but it affects the skin in that the skin cells respond by dividing too much and creating these thick raised plaques that have this overlying prominent scale. Psoriasis can lead to skin lesions pretty much anywhere on the body, but most often is going to happen on the knees, on the elbows, the lower back, and of course in the scalp. Now, dandruff, on the other hand, is a chronic inflammatory skin condition, but it doesn't create inflammation throughout your body. It just affects your skin. It can affect the skin in your scalp, and we call that dandruff, but it also can affect the skin on your face and other body sites. And in those cases, we call it seborrheic dermatitis. But when it affects the scalp, you get these little, well, flakes, right? Dandruff is actually caused by a couple of factors. Oiliness, hence the name seborrheic, oiliness, sebum, plus the little yeast that lives in our skin, malassezia. Your body mounts kind of an abnormal inflammatory response to that little yeast who is thriving in oily patches in your scalp and maybe other places on your body like your eyebrows. Both dandruff and scalp psoriasis can come and go and flare with certain triggers. It's common for them to get worse in the winter time. It's common for them to improve when you go on vacation. What causes psoriasis? Like, what causes an individual to have psoriasis? Someone has psoriasis because of their genetics combined with environmental exposures. There are certain characteristic environmental exposures that will trigger psoriasis in people who have the correct genetic makeup to have psoriasis. For example, getting a strep throat or getting sick, certain medications. If you have psoriasis, though, you don't necessarily need to be exposed to these things to deal with psoriasis on your skin. Why do people have dandruff then? People have dandruff likewise, probably because of their genetics, and again, certain environmental factors can make dandruff worse. All right, now that I have explained sort of the differences between these disorders, how do you know what you're dealing with in your scalp? Is it psoriasis or is it dandruff? Both of them make these flaky patches of skin. Both scalp psoriasis and dandruff, they can be itchy, but here's a clue that lets you know what you're dealing with is actually scalp psoriasis. If you scratch or you try and pick off those flakes and you get this little pinpoint bleeding, if it bleeds at all, actually, it's psoriasis right there. Dandruff does not bleed, unless of course you are scratching so intensely that you are digging and scraping at your skin. Specifically though, with scalp psoriasis, if you try and pick off the flakes, you can get little pinpoint bleeding. Remember, with psoriasis, the skin cells, they're dividing too much, so they get this blood supply to that thickened area of skin, and so as you pick off those flakes, you can see, even on the areas affected, these little dots of blood. Psoriasis in general, including when it affects the scalp, is characteristically well defined, and what I mean by that is you will have these areas of affected skin that are raised, thickened, and have that scaly stuff, right? And they have a very clearly delineated border to them. Scalp psoriasis may even extend along your frontal hairline onto your forehead, behind your ears. Dandruff does not typically do that. The borders are ill-defined. If you were to shave your head and look at your scalp, if you have scalp psoriasis, you're going to see these raised, thickened plaques that are, again, well-defined. But if you shave your head and you have dandruff, chances are you're going to see some areas of redness that kind of look greasy and shiny, and you'll have patches of overlying flaky scale. Dandruff is a oily skin condition. Psoriasis is not. So the affected areas of dandruff, while they can feel tight and dry at times, depending on the weather and your hairstyling practices, there is an element there of oiliness, of shininess. Like I said, if you were to shave your head, there's this kind of greasy sheen to the areas of dandruff. Psoriasis is not going to have that. Now, the other distinguishing feature between the two is where dermatologists really geek out, and that is you got to take a look at that flaky white stuff that's coming out of your hair. We actually look at that. That is how we tell all sorts of skin diseases, is just by like what kind of flaky white stuff do they make. The flakiness of dandruff, they're fine little flakes. Remember the scene from The Breakfast Club where the brunette scratches her head aggressively over her drawing of a house and then all of a sudden it looks like it has snow? Yeah, that is characteristic dandruff. Psoriasis, on the other hand, the scale, the flaky stuff, it's what we describe as micaceous. The individual flakes are going to be much larger in size and they sort of overlap, similar to the appearance of mica on a rock. rock. If you have ever seen a rock with mica, it's got that shimmery, shiny stuff, and if you were to look at it very carefully, it's almost like it's these sheets of shiny material that overlap. Psoriasis scale is very much like that. You're not going to get that sort of fine scale that you get with dandruff. So if you were to look carefully at the flaky stuff coming out of your scalp, it's going to look much different. Dandruff, it's fine. Psoriasis, much larger and micaceous. Speaking of what the scale looks like, dandruff flakes are white regardless of your skin tone. Like as they come up through the hair, you'll see these little fine white flakes. Now, psoriasis, when you actually look at the skin lesions, if you have a paler skin type, the scale of psoriasis is going to appear silvery white. If you have a deeper skin tone, it's going to appear more purplish violet to dark brown. But as it is coming up to the surface, it will start to appear more white on top of a background of sort of dark purplish brown. Speaking of picking off the flakes and taking a look at them, here's another key distinguishing factor. Dandruff, you can go like this and let the flakes fall down. Yay, that's fun. No problem. If you do that with psoriasis, what's going to happen is you're actually going to cause more psoriasis to come out. It's called the isomorphic response or Kebnerization. Basically, anytime there is any type of skin injury, it elicits more psoriasis, more of that abnormal cell division in response to that injury. It's a abnormal wounding response is what happens with psoriasis. The cells are dividing abnormally to create those thickened, scaly areas. So when you scratch aggressively, pick, you will elicit more psoriasis. Your dandruff, on the other hand, will not get worse by doing that. It's not a good idea to pick it off and, agitate your skin like that. You might get some irritation, but you're not actually going to worsening of your dandruff doing that. Likewise, other things that put aggressive traction, trauma, potentially pose threat of skin injury to your scalp will worsen psoriasis. That includes wearing tight braids, tight hairstyles, heat styling, perms, relaxers, being really aggressive with your comb or your brush, blow drying your hair on a high heat setting, and especially if you tend to hold it too close to the scalp and hold it in one area for too long, yeah, that can worsen psoriasis. Dandruff, on the other hand, your scalp may get dry, it may get irritated, but you're not actually going to have more flakes as a result of doing that because it does not respond with the isomorphic response. It's not a skin condition where you have Kebnerization. Both scalp psoriasis and dandruff, you can have skin lesions on non-scalp locations. More common for people with psoriasis to deal with psoriasis on other body locations, although there are exceptions, of course. Some people with psoriasis, it's only in their scalp. They don't have skin lesions elsewhere. But if you do have areas of thickened skin, like on your elbows, your knees, that's a clue that what you're dealing with in the scalp also is likely psoriasis. Seborrheic dermatitis, on the other hand, you get these kind of greasy, flaky patches in your eyebrows, your forehead, the sides of your nose. If you have a paler skin type, these affected areas on the body may kind of appear light pink, and again, sort of have that greasy overlying fine scale. If you have a deeper skin tone, on the other hand, what can end up happening if you get dandruff, seborrheic dermatitis on non-scalp locations is it can take away the color of the skin there. So you can get patches of hypopigmentation. It's temporary, the skin color will return. While psoriasis can appear on the face, in adults, it's not typical for that to happen. It can, but it's not typical. Children, on the other hand, more likely to have facial psoriasis. Here's another thing to look for. It's not a guarantee it's going to help you out, but look at your nails. Psoriasis commonly can affect your nails. Dandruff, seborrheic dermatitis does not affect the nails. If you have little pits on your fingernails, good chance you have psoriasis. If you have little yellow, white spots on your fingernails, good chance you have psoriasis. If you look at the skin around your nails and you get like buildup of what looks like dry, flaky skin, could be your psoriasis there, okay? More likely that you have psoriasis. Dandruff does not affect your nails. Now, I have a lot of videos on my channel on the best shampoos for dandruff, talking about different anti-dandruff ingredients. And I also have videos on shampoos for psoriasis. Spoiler alert, many of the medicated shampoos that can be helpful for dandruff are also helpful for psoriasis. In fact, recently I did a video on the best shampoos for scalp psoriasis. Check that one out. Here's the thing though, dandruff you can control with just the medicated shampoos. Not everyone, but there's a good chance you can control your dandruff just using the right combination of medicated shampoos from over the counter. It's very possible. Sure, you may deal with flares here and there, but you can control the condition for the most part with over-the-counter stuff. Sometimes a prescription is needed, but it's very possible to control dandruff with over-the-counter medicated shampoos. Psoriasis of the scalp, on the other hand, the medicated shampoos can help control symptoms to a certain extent, and they can help allow for medication medications to penetrate the psoriasis better, because remember, psoriasis, you have these areas of skin that's dividing too much and the skin's thick. So getting medication in there is not as easy. The medicated shampoos can help, but they're almost never enough to control scalp psoriasis. You're not going to control your scalp psoriasis with just shampoo. Here's another big differentiating factor that is very important, and why it's so important to know what you're dealing with. Psoriasis is an inflammatory disorder that affects you internally. Dandruff does not affect you internally. With psoriasis, you have elevated inflammation in your body. It is a systemic disease that has skin findings. Dandruff is a skin disorder. Psoriasis leads to higher inflammation throughout the body. People with psoriasis, especially that is untreated, are at greater risk for cardiometabolic disorders like heart disease, diabetes. They're also a lot more at risk for certain mental health disorders. And why that is, we're still working it out, but likely the inflammation that they have plays a role in that. And that includes depression, substance use disorders, anxiety. People with dandruff are not more likely to struggle with those issues. Also, with psoriasis, it's very possible that you go on to develop a arthritis that, if it goes untreated, can be quite debilitating. It's an inflammatory arthritis. Arthritis is just inflammation in the joints. So that's another one. Dandruff does not affect your joints. Psoriasis can affect your joints pretty significantly. The joints of your hands, your feet, your back. As a side note, if you have looked at your nails and you do see nail pitting and changes characteristic of psoriasis, which, as a side note, I have a whole video going on a deep dive of nail changes of psoriasis. So watch that video, okay? That way you know what specifically to look for. If you have nail changes, it's more likely that you develop arthritis in your hands. So it's definitely worth taking a look, especially if you already know you have psoriasis or you're here trying to figure out if you do. All right, guys, so that's kind of the difference between psoriasis and dandruff, how to begin to tell the difference between the two. But let me tell you, even dermatologists can struggle to figure out which one it is because they can look very, very similar. And unfortunately, you can have both. I know, very frustrating. Always see a board certified dermatologist when it comes to any skin disorder that you're not sure, like, is this a problem? That way you know what you're dealing with. Because the treatments for both, yes, there's some overlap, but the treatments for psoriasis are, there's a lot more that goes into treating psoriasis than what goes into treating dandruff, and there are different treatments that are, appropriate. I hope this video was helpful to you guys. On the end slate, I'm going to put that recent video all about the best shampoos for scalp psoriasis. Check that one out next. Also, make sure to check out my video on the nail findings of psoriasis. That way you know what to look for as well. But if you enjoyed this one, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.